Hi, everybody. Um, Thanks for tuning in. Really honored and grateful to have an extraordinary woman joining us today for our broadcast this evening. She's a nurse at Morton Hospital in Taunton, Massachusetts, which is about 45 minutes to an hour or so south of Boston, an old industrial manufacturing community. Still an awful lot of manufacturing that takes place in that community. And that hospital is a critical area in need, but also a critical hospital in order to take care of people in that region, south of in the southern part of Massachusetts and south of Boston. And so, going to get her perspective, Jackie's perspective, from what it's like to go to work every day, from somebody that's been in the medical field now for years, and the challenge of going to work in a hospital at this moment with a family, including family that has come from all over to move back in together. She's got a number of children that are college aged, and one a young daughter who's a nursing student. So talking to her a little bit about what what this means for her and her family, and what this means for her daughter, as she's starting to see on the one hand, the extraordinary heroism of our first responders and our people caring for those in need, and also in times like this, the danger that nurses and doctors are shouldering. So a great conversation, and hope you'll stick around for it. Did want to just touch base really quickly on some of the latest news here. The big headline coming out today: 6.6 million new unemployment claims, on top of the 3.3 million from last week. Devastating. We are seeing the economic toll of this crisis just wreak havoc across our economy. But we also know that the best way to actually get through this, the only way to restore confidence in our economy, is to get in front of the public health crisis. We have to get this virus under control. And so the measures that we put in place last week with the passage of this rescue package, the measures that we're trying to deploy as rapidly as possible in terms of those direct cash payments to families making under $100,000, to small businesses, including loans that can be forgiven of up to $10 million to try to keep people on the payroll, pay their benefits. All about trying to make sure we inject the money into this system to make sure that people can meet their obligations and pay their bills and keep themselves afloat until we can get by this public health crisis. In the meantime, still working hours a day to trying to chase down personal protective equipment. Jackie will talk a little bit about how the supplies and how tight they are, and the measures that they are putting in place to try to make sure that people do get access to equipment. And great news today that the Patriots the Patriots organization, in conjunction with the Commonwealth of Massachusetts, are flying in about a million sets of personal protective equipment from China. Plane is due to land later today. Really, an awful lot more work that needs to be done. We're seeing the enormous impact of this virus hit terribly close to home, in almost every home across the country. And we've got Jackie here to fill in a little bit about what that means for her and what it means for all of us. Jackie, why don't we start just by telling us a little bit, one, about yourself, two, about what your job looks like today and what your home looks like today. I know you're talking to us right at the moment, quarantine in your house. So talk us through that, what it's like on that.
Sure. I am a registered nurse. I've worked at Morton Hospital for going on 16 years now. I've worked all over the hospital, from med surg to maternity to the PACU, which is the recovery room. I've worked on the cardiac floor for a short amount of time. Now I'm currently working on the psych floor, which is the elderly behavioral unit. And so I've been all over the place. I'm the chairperson for the union, so I am in close contact with everybody pretty much every day. So I get a good feel about what's going on around the hospital. As far as my home life, since this has begun to spread, since the COVID has begun to spread, as widely as it has, and my husband has chronic lung disease, And my daughter's a nursing student. She's moved home from UMass. She has an apartment across the street from UMass that, of course, we'll continue to pay for, but she needs to be home, and they've closed campus, and she's doing everything online. And my husband, because of his chronic lung illnesses, I've moved into our spare room. So I have a little spare room set up. This is my little palace. So I come home, before I get into my car, I change my shoes. As I come home, the bathroom, we have moved the washing machine upstairs so that I can take my scrubs off right outside the bathroom, deposit them directly into the laundry, shower, and then come directly up to my quarantine bedroom. So we kind of live like that. We, yeah, yeah, until this is all calmed down. Yeah, for sure. I have a friend that's making me a cotton mask so I can wear it around the house in case we run into each other, just in case I'm carrying something, because the chances of him getting gravely ill are higher than the general public. So we're all being very careful.
And tell me about what it's like in Morton Hospital. For those that don't know, Morton Hospital is a regional hospital in Taunton, Massachusetts. About, without traffic, probably about 45 minutes to an hour outside of Boston. It's an old manufacturing city. Taunton used to be known as the Silver City, but blue collar, very proud, hardworking folks. And that hospital there is a critical component of access to regional care, right? It's not, it has critical services for folks in that area. And if you need kind of level 1 trauma centers, whatnot, you have other places to go, but then you can get stabilized there and then transported, right? But it's a critical link in that chain to access to care. So what's it like at the moment in Taunton?
So we had a decrease in the volume of people coming in just to, have their, runny noses looked at, or, for small things. We still have the same volume for car accidents and strokes and heart attacks and those sorts of things. And then they have an outpatient tent, or rather, we have a new emergency department, and our old emergency department is set up as the COVID ER. So they bring our patients through a different kind of, it's a veer off from the regular hospital, go into the waiting room of the old emergency room, and the patients for COVID are handled in that way. I think our major hurdle right now is just that the swabbing the results have taken up to 10 days to get results back. So they're swabbing people and sending them home. Even the nurses that have symptoms are being swabbed and then sent home to their families, to try to quarantine, and they're not lucky enough to have a spare room in their homes, and small children, so they're kind of holing up in their bedroom, but it's not really a sustainable thing. First, we were told that it would be 24 to 36 hours before they were getting results. In reality, it's turning out to be 8 to 10 days. So
why so long? Why so long?
I don't know. That's just as long. We were first told, hey, we have these tests, they're coming back really quickly. But then the nurses that are showing symptoms are, calling me and saying, hey, I'm being told now it's 8 days, it's 10 days. So they're trying to shelter in place with their families that are, at risk of being exposed. So they're trying.
And are you guys if somebody's in quarantine, are they getting paid?
So what they've done is they have eliminated the waiting time for short-term disability. So you can apply for short-term disability immediately upon the beginning of your quarantine. So, and we're trying to negotiate them paying the difference between your short-term disability and your regular salary. We're still working on that, though. So they are taking a hit, so from their full pay to 60%.
60%. Are you seeing people come in on a daily basis? Are you guys overwhelmed yet, or are you expecting to be? Kind of walk me through that.
Definitely expecting a large increase in volume. We have what we're calling the COVID floor. It was a med surge floor on the second floor, and that's where we're housing most of the people that don't need cardiac cardiac monitoring. Then we have the cardiac floor that has, they've been pretty inundated. They have probably 10 patients all the time. And where you don't have, in this circumstance, you can't really double patients up in a room. So everybody's got a single room just in case. So the volume capacity of our floors has gone down by half, really. So they have quite a bit of patients, and where the practice of, getting gowned up and masked up and all of that takes quite a bit of time also, they're struggling to keep up, and some of them are working 12-hour shifts, so it's a long, long day of repeated exposures, and they're quite nervous because they're not necessarily getting N95 masks unless the patient is being suctioned or having breathing treatments, which is not really the best science at this point, but because everybody's trying to conserve their personal protective equipment, it's what we're using, even though it's not really conducive to preserving your workforce.
And do you guys have, so it sounds like you do not have, or you're running low on a PPE for what you would use under a normal course, right? The hospital adjusted their policies about who uses what and when.
I don't think that we're running low, but I think that they're trying to conserve what they have. So it ends up putting us in what we know is an infection control. We have already always all been trained on infection control. We know what the best practice is, but because people are trying to control their stash, they want to compromise what we know is good infection control. So we know we're being put at risk. We know that at one point they were not giving the nurses N95s to run the COVID clinic. They were just using surgical masks to swab. We know that's not the best science. We know that's not the most cautious way. We know that nurses are out now with symptoms because of that. And now, they've come back and said, well, maybe we do need N95 masks for that. But it's the back and forth of those kinds of policies that are putting us all at risk. So to come out with the most cautious policy to begin with would seem like the most sensible way to handle these things.
And how many, are there a lot of nurses that are sick with they're suspected to have contracted the virus?
So at last count, I know there were 12 nurses out, and that was, and 4 respiratory therapists. And that was probably 5 days ago that I got the last count. So I don't know what's happened in the meantime.
And so what does this mean for you and your family? I mean, you got a pretty full house. So what does this mean for your daughter? I mean, she's a nursing student. What does it mean for your husband? Just kind of walk us through what the family side of this is. I assume the stress and anxiety that everybody's facing.
So, between, trying to keep everything together at the hospital, making sure that I'm available for all the nurses and trying to take their concerns and bring them to administration, having conference calls with corporate and our CNO, and also making sure that I'm open to, an open line of communication, and then to come home and try to make sure that I'm paying close attention to the anxieties that definitely pop up here at the house. And I definitely am the one going out and making sure that I'm doing the shopping, and, because I'm the most exposed anyway. So going out and doing the shopping and, whatever else needs to be done outside of the home. And then at the same time, coming home and then quarantining here in my room. But we have, technology. Thank God for technology. We FaceTime, we talk all the time. It's not quite the same as, being able to sleep in the same room with my husband or anything like that, or hanging on TV together, or hanging out with my kids. But, it's what's going to have to be for this foreseeable future. And hopefully, we can get over this, before the fall.
And how's your daughter? How's she taken? She's moved back. She's living with you guys. I mean, it's got to be somewhat weird to have mom be living in a room, particularly in a profession that she's aspiring to join. have you talked to her about it, or any light that you can shine there for those of us that just are?
I think
Um,
she has, I think this is the first time that she's really considered the dangers of nursing. At the same time, I think she's been very involved. And she's always been very involved with me and with my union things. And I think that she's really working with me and listening and paying attention to the fight for proper equipment. She had been offered the opportunity to work in a hospital as a CNA on a COVID floor, but her concerns with the lack of PPE has been the reason that she's not accepted that, because if she can't be guaranteed, to have safe equipment, then it's just not worth the risk. So although she's anxious to be out there helping, it would be ultimately hurting if she came home and passed something else.
Jackie, thank you. Thank you for what you're doing. Thank you for your courage and your bravery and your willingness to take care of everybody else at this extraordinary time of need, but knowing that you're also putting yourself at risk. So thank you.
It's what we do. We're nurses.
Yeah. Stay healthy, stay safe, and please let us know what we can do. Okay, please.
I truly appreciate it, and I
Thank you.
appreciate the opportunity to discuss it with you also.
Absolutely, absolutely. Really honored to do this. Hang in there. Good luck. All right.
And stay safe.
You too. Jackie, I think I just want to start where I think everybody is at this point by saying thank you. Thank you for your courage. Thank you for your service. Thank you for being willing to shoulder this enormous burden for yourself and your family, particularly as somebody who's got a husband that has chronic respiratory issues, and understanding that your work at this point asks a tremendous amount of everyone in your family. And the admiration that we have for you, the gratitude that we have for you, and the millions of others like you across the country knows no bounds. So thank you for what you're doing. For everybody else out there, after hearing what Jackie has talked about and what she's gone through and what she's going through, I think we all understand that each and every one of us can play our part here, really abide by those social distancing requirements and those orders, understand that every single one of us can do something to limit this impact and the spread of this virus. Stay healthy, minimize your time around other people, observe that social distancing. Even when you got to go to the grocery store or the pharmacy, make sure that those visits are quick, make sure that you're deliberate about getting through there, make sure that you're doing everything you can, knowing that this virus can spread even if you aren't showing symptoms, even if you don't think you have it, it potentially can spread it to other people. So we need everybody to do their part. We're all grateful for it, and I'm sure Jackie is, and we're all grateful for Jackie. So thanks for tuning in. Take care of each other, stay healthy, stay well, and we'll see you soon.